The gentleman is recognized for 2 minutes.
I thank the gentleman from California and ask unanimous consent, Mr. Speaker, to revise and extend my remarks.
Without objection.
I thank you, Mr. Speaker. I think it's time for us to take a deep breath, take a time out, and go home and listen, Mr. Speaker. So I ask the Rules Committee this evening to not move this package tonight, but let us go home for the next 2 weeks and then come back week after next or week after the 2 weeks and actually fix what needs to be fixed. I listened when my chairman, Mr. Waxman of California, talked about the reconciliation package before us fixes the Nebraska problem. Well, the way they fix it, Mr. Speaker, is by giving every other state the same sweet deal that they gave to Nebraska, but only for 4 years. After 2014, that deal goes away for Nebraska and every other state. I don't think that's much of a fix. No one on the majority side, Mr. Speaker, has talked about the Medicaid trap. When this fully kicks in 2014, everybody that's eligible for Medicaid in the country, that is below 133% of poverty, has to be in Medicaid, and that's their only choice. They cannot be in a private sector plan. And obviously we all know they don't have the option of not taking the coverage. Some of us think that that may be unconstitutional. Even if it's not unconstitutional, I don't think it's fair to our low-income Americans to say that the only health insurance plan you can have is Medicaid. We've talked about the pre-existing conditions, Mr. Speaker. This bill does require that pre-existing conditions be covered. That's a good thing, not a bad thing, but it's not funded. They've only got $5 billion in this bill for 4 years. That's a little over $1 billion a year. You can't cover 8 to 10 million Americans that have pre-existing conditions and no insurance today for $1.25 billion a year. I call that the pre-existing short sheet. And finally, this reconciliation package doesn't do anything to prevent the requirement in the original Senate bill that's now the law that elective funding of abortion be offered in at least one plan in each state. I really believe if there was an up or down vote on that, again, in this body, that would be voted down. Please vote against this reconciliation package rule. Let us go home and listen to our constituents. Thank you.